Well, growing up, I always wanted to be a doctor, and I was raised with the importance of giving back. So when I went to medical school, my intent was always to work in an underserved area.
Community health centers, also known as FQHCs or federally qualified health centers, provide quality primary health care to medically underserved populations.
So when I had an opportunity to work at an FQHC, I jumped at it, and it has been very rewarding and fulfilling.
More and more doctors, dentists, and other healthcare providers are choosing to work at FQHCs as they discover that mission, quality care, and community add up to a satisfying career.
I suppose you could say that the motto for health centers is that no patient is turned away. Everybody is seen, no matter their economic standing, no matter what. We have many programs that allow every patient to get the quality care they deserve. Basically, at the end of the night, you can always go to sleep knowing that you've done something good for somebody every day.
Everybody's welcome there. We have folks that speak our language and don't speak our language, folks that can pay and folks that can't.
So I work in a health center where there's multiple providers, from family medicine to pediatrics to internal medicine, and all of us log information in the same patient chart. And it's interesting to find that many of the kids that I take care of, their parents are also here at the same facility too. So being able to provide care to the whole family structure has been a really nice dynamic.
I do obstetrics, and so I deliver babies and then get to know babies to grandparents in the same family. So the relationships are deep, they're old, and they're wonderful.
An FQHC provides a medical home for all patients of all ages and for many types of services. We provide prenatal care up to geriatric care. We provide mental health. We provide dental care, and we provide as much primary care as we can for our patients.
I found working in an FQHC to be a really rewarding experience. I feel like the patients I take care of get excellent care. I have a lot of partners who help me care for patients, and I feel at the end of the day that I've done something to improve the health of my community.
I know I'm working with high-quality physicians and dentists, and I feel great about the quality of care we're providing here.
You're working amongst colleagues that are like-minded. They are collegially, there are better interactions that occur. They feel more comfortable because, unlike private practices where you don't have social work support or having health educators, they feel that they are part of a team, that it really is making a difference in the community.
There's just like a whole team of people that you can refer to and that you can go to, and the support is there, whereas in private practice you're sometimes isolated because it's just you.
It's really wonderful to have staff who are devoted to taking care of the administrative needs of the physicians here at the health center. There are people who will go through your credentialing paperwork to help you finish that whole process so that you can focus on taking care of your patients on a day-to-day basis.
Health centers have quality assurance programs in place to monitor the quality of the care being provided to their patients.
FQHCs are really going to be able to shape the future of healthcare. With healthcare reform, millions of people are going to have access to insurance, and they need to see primary care physicians. FQHCs are uniquely positioned because of the comprehensive primary care services that we provide.
Health centers are utilizing the latest technology and making sure that their patients benefit from that technology.
FQHCs have always been leaders in terms of the quality of care that they provide, and I believe in this frontier of emerging technology in terms of the electronic health record, FQHCs will be some of the earliest adopters, because that will help us to provide even better care and also be able to drive improvement based on data that we can glean from the electronic health record.
Federally qualified health centers have been on the forefront of disease management and building registries of patients and monitoring those registries and making sure that all of the individual's care is met.
Well, FQHCs pay competitive salaries. They pay salaries that are competitive with other institutions and other private organizations. There's also a malpractice benefit. The malpractice is covered through the Federal Tort Claims Act, which is essentially government protection.
In addition, most of the FQHCs also provide the availability of loan repayment, which is a very good perk for someone that's coming out of school and you're saying maybe investing 2 to 4 years of your career to have your debt basically wiped out. It's a drop in the bucket when you look at the time that you spent in dental school and undergraduate. The 4 years goes by so fast. It's a no-brainer, basically.
When I went to work for the health center in my own community, I found out that I was actually able to take part in a loan reimbursement program by the National Health Service Corps. It's a great program. It's a wonderful bonus for anyone looking to help repay their loans.
I came to an FQHC because of a 4-year obligation that I had with the National Health Service Corps, but I remained at the FQHC because of the ability to serve people who would otherwise not have access to care.
We have a saying in the health center world that when you've seen one health center, you've seen one health center. Our health centers vary in appearance and size and location, as do the communities that they serve.
FQHCs come in all shapes and sizes, from very small organizations to very, very large organizations with highly structured staffs. They also are in urban areas, in suburban and rural areas, so you can find a community that is right for you.
In Pennsylvania, more than 200 FQHC sites serve more than 600,000 people each year. Being part of an FQHC makes you part of the largest primary care network in the nation. Find out what your opportunity at a health center can be.
I know families that they get to know me and that we can actually facilitate better health for their whole family.
They are remarkable people who face huge obstacles every day to not only to get health care, but to have enough to eat, to have a warm bed. And as I know these people, I find that the healing really goes both ways.
But when you're here at a health center, it's like your home, and everybody around you is just like your family.
The community really embraces the doctors. It feels great to be able to ride around and people wave to me in the streets.
We take great pride in the work that we do. To see the patients come in who have been without work and in need of services for such a long time, and to help these people and give them high quality of care, there is no measure that can be placed on that. It's a wonderful thing to do for these people.
It's so inspirational to me that just to know that I'm not just working to make a paycheck, but I'm actually making a big difference in the lives of people who otherwise wouldn't have access to great care. So I'm so happy to be here to use all the talents that I have to help others who really need it.